Hello, my name is Diabante. I'm going to define cost containment. I'm going to explore diminishing resources, and then I'm going to dive into strategies to retain staff nurses. Come with me on this journey. Cost containment is the practice of controlling expenses by reducing or limiting spending to stay within specific budgetary limits. What does this mean for nurses? For nurses, this means staffing ratios. Me, as the staffing coordinator, I'm going to schedule two nurses a charge and one CNA for 21 patients because the law states a nurse can have six, a CNA can take 20, and all the patients aren't that critical. As nurses in healthcare, we are one of the diminishing resources. According to the American Association of Colleges and Nurses, by the year 2026, we'll need an additional 200,000 nurses to meet our growing population demand. Among 21,000 people surveyed across 42 major hospitals, 38% self reported experienced anxiety or depression, another 43% suffered from work overload, and 49% had burnout. With the failure of Bill H.R. 2392 in 2018, this has led to unregulated nurse to patient ratios, ultimately leading to the burnout that nurses currently feel today. Advent Health and Halifax Hospital both have new grad programs in which the new graduate nurse can take additional classes at the hospital to make them a more competent nurse. The nurse grad program is designed to be the bridge between school and work. On your left will be some things that will be completed in the first 4 weeks of the program, then followed by 9 weeks with you and your preceptor on the floor of your choice. Let's talk money. Excuse me. Let's talk contracts and their effect that they have on nursing. Here we will explore different types of contracts. Let's begin. The new grad contract can range from 1 to 2 years, with Advent being one and Halifax being two. You also will have seasonal slash travel contracts, which range from 8 to 13 weeks in time frame. And our last contract that we discussed is the experienced nurse contract, which is geared towards nurse retention. This type of contract typically has a higher sign on bonus and has a longer time and years committed to the facility. In an effort to keep nurses on staff and also recruit more nurses, hospitals have turned to offering scholarships for work placement. As recently as April 2021, a recipient won a $500 scholarship based out of Halifax. Another strategy that hospitals have used to keep nurses on staff is workplace life. So, Abbott Hospital is using Facebook posts from their nurses in their daily huddles, and Halifax Hospital is using nurse themed football luncheons to keep and recruit new nurses. Recently, Halifax Hospital has implemented the Nurse Flex program, paying nurses $45 an hour amid rising COVID cases. This is in an effort to keep nurses from leaving to go traveling or work for other agencies that are paying more money. The interview process is the first step in determining if someone is the right fit for your unit and if your unit is the right fit for them. It has to be a two-way street. It's also your opportunity to set clear expectations for prospective employees. Take time to recognize the great things that your nurses are doing every day. Hold a huddle before each shift to compliment staff members who receive positive patient feedback. Also, this would be a great time to address any updates on unit improvements and share other motivating and positive news. To support nurses on their career journey, organizations must establish a culture that promotes learning and leadership development. Not only will additional resources impact the nurses' ability to care for their patients, continuing education and clinical training will help prepare them as decision makers within the larger scope of the healthcare industry. A nurse that has an input is more likely to stay, while a new nurse likely understands that working weekends and holidays is part of the job, having a say in which ones can make them feel less dissatisfied about it. The focus has shifted away from clinical and technical skills to behavior competencies. All of the research points to the fact that non clinical skills like positive attitude, teamwork, collaboration, drive, and initiative impact both performance and retention. Thank you for watching my part of the presentation. I'll pass it off to my smart, courageous, intelligent, sophisticated, well mannered future colleagues.
Hello, my name is Sungnam Kim. I'm going to discuss about diminishing resources due to COVID-19, and I'm going to discuss about cost containment strategies. Due to COVID-19, the US healthcare system has been experiencing severe shortage of resources such as personal protective equipment, testing supplies, ventilation related products, and employees. Personal protective equipment is defined as equipment run to minimize exposure to hazard that cause serious workplace injury and illness, according to Occupational Safety and Health Administration. Personal protective equipment is a key component of infection prevention for healthcare workers. Without proper personal protective equipment, healthcare workers are more likely to exposure to infectious pathogens. Most common PPE in healthcare system include masks, especially N95 respirator mask and surgical mask, gowns, gloves, and face shield. Above listed all PPE were in severe shortage during COVID-19. The cause of this shortage is increasing demands and disruption of manufacturing and distribution channels. One of the world's largest producers of gloves, the Malaysian company Top Glove, had to shut down some of its factories temporarily because of an outbreak of COVID-19. We have been also experiencing shortage of testing supplies and equipment such as pipette tips and centrifuge tubes. The surge of this material is caused by increasing demands and disrupting of manufacturing and distribution channels. Unfortunately, according to the US Food and Drug Administration, these shortages of lab supplies are expected to last for the duration of the COVID-19 public health crisis. The ventilator is a machine which helps pump oxygen into your body. This is a key equipment needed to care for critically ill patients, such as a patient in an acute respiratory disease syndrome, which occurs in a COVID patient. There is a broad range of estimates of the number of ventilators needed to care for US patients with COVID-19, from several hundred thousand to as many as a million. No matter which estimates we use, there are not enough ventilators for patients with COVID-19. Treating patients has become more expensive during the pandemic because of increasing of medical supplies. Hospitals and healthcare providers are contending they should not bear the cost of this for themselves. PPE costs increased over 1,000% during COVID-19. Most skilled nursing facilities treating COVID-19 patients have experienced 1,064% increase in costs for required PPE. Hospitals have experienced increased costs for non-PPE supplies and equipment because many hospitals acquired a ventilator for treatment for COVID-19 patients. For example, New York State had to pay over $50,000 to purchase a ventilator. Due to the pandemic, medication supply chains have experienced increasing demands for certain drugs necessary to treat the patient with COVID-19. This situation have created drug shortage for many vital drugs, resulting in higher costs for hospitals. Since the COVID-19 pandemic outbreak, hospitals continue to experience losses from canceled and delayed procedures because people have been hesitant to go to the hospital for medical care. It is expected that hospitals could lose between $53 billion and $122 billion due to the lingering effects of COVID-19. It will rely on control of the COVID-19 and prevention of the re-outbreak. Another concern is the cyclical rise and fall of COVID-19 surges. As residents stop social distancing before herd immunity is reached, they will affect hospitals to lose more money if hospitals adapt to a new normal of slow or only partial recovery of patient volumes. Hospitals need to adopt cost containment strategies by preventing unnecessary spending while thoughtfully reducing expenses to improve profitability without risking patients' health and employees' welfare. Some cost containment strategies include standardizing purchases and eliminating wasteful practice. For standardizing purchases, healthcare systems need to review vendor contracts to see what can be reduced and evaluate purchased services. By eliminating wasteful practice in healthcare system, workload balancing can be achieved. Since labor generally represents the largest portion of cost in healthcare industry, workload balancing will be one of the most efficient cost containment strategies.
Hello everyone, it's Ivana. I hope you are learning a lot of new things in regards to cost containment and diminishing resources. For this final section of the presentation, I will be covering how it is related to telehealth and preventative healthcare measures. I hope you enjoy. Technology has been positively changing the practice of medicine for many decades. Some examples of the tools that enhance quality care include 3D printing, digital records, online payer portals, and of course, telehealth, also called telemedicine. Telehealth is the use of digital information and communication technologies such as computers and mobile devices. Telehealth gives access to healthcare services remotely and in real time. This convenient service allows healthcare providers to manage their patients without physical contact. Telehealth offers many different options. These options include talking to the doctor live over the phone or video chat, sending text messages, emailing the doctor. Also, there's remote monitoring, which allows the physician to have immediate access to important data such as vital signs and EKG. Telehealth benefits include 1. Easy to use. 2. No physical contact, which will reduce exposure to COVID-19. 3. Appointments can take place anywhere as long as there is internet connection. And 4. Increased access to specialists since it is virtual. Another pro of telehealth is that it is cost effective for both the patient and the healthcare facility. It reduces costs for the patient in many ways, such as avoiding unnecessary and expensive trips to the emergency room. In general, telehealth visits cost less money than in-person visits, ranging from $10 to $121. Under the Trump administration, the Center for Medicare and Medicaid Services, also known as CMS, broadened access to telehealth services. This waiver allowed beneficiaries to receive services from a wider range of providers, which included nurse practitioners, psychologists, social workers, and doctors. According to a cost analysis conducted in 2020, telehealth helps reduce costs in the healthcare system in 4 main areas, which are productivity gains, reduction in secondary care, alternate funding models, and telementoring. Other benefits that telehealth has in the healthcare system includes reducing patient transfer, improving clinical metrics, helping with the patient satisfaction, and staff retention. These elements play a key role in cost containment, incremental revenue, and diminishing resources. With the emergence of the COVID-19 pandemic and shortage of adequate personal protective equipment, telehealth played an important role with cost containment and diminishing resources. By using this virtual program, PPE was conserved by the healthcare workers and patients. During the beginning of this pandemic, we all sadly experienced or were updated by the media on how healthcare workers were overwhelmed. We also saw that some hospitals were reaching their capacity. Telemedicine helped relieve this issue by consulting patients virtually. This chart is a telehealth regional tracker that focused on the southern states. In July 2021, the top 5 diagnoses were number 1, mental health conditions, 2, acute respiratory diseases, 3, skin infections, 4, UTIs, and number 5, joint/soft tissue diseases. According to the data on the previous slide, mental health and respiratory infection were the 2 leading diagnoses that led to telehealth calls. I will now highlight preventative measure techniques we can use in order to educate the public about these prevalent health issues. During this time, we currently have the technological capabilities to reach a larger amount of people than ever before by the use of social media platforms such as Twitter, Instagram, and Facebook. We can disseminate essential information to the public in record time, which is crucial since healthcare workers are a diminishing resource. In regards to mental health, we can teach the public about strategies to help with mental health disorders such as anxiety and depression. We can share informative posts about non-pharmacological techniques such as proper diet and exercise, meditation, and self-care. The use of social media also allows healthcare workers to educate the public about the importance of mental health and share credible resources to the community. Some resources are crisis hotlines, informative websites, and internet therapy sessions. In response to the impact of the pandemic, Facebook recently launched a new feature called Emotional Health Resource Center. This feature allows access and connection to resources on financial stress, parenting support, coping with grief and loss, substance abuse, and many more. Healthcare workers also shared information online on their platform about the pandemic. Some topics covered included COVID-19 precautions, signs and symptoms of infection, diet and exercise, and information about the vaccine. In addition, social media also help the public keep up with the latest updates from the CDC, such as information about the variants, different vaccines available, testing sites, myths and facts about COVID-19, travel guidelines, and much more. The The pandemic taught healthcare workers to be more resourceful and resilient in continuing to deliver care to the community. Telehealth and social media will continue to be key features in the ongoing evolution of the delivery of healthcare to the general public. And that brings us to the end of our presentation. We thank you so much for watching. We hope you enjoyed and learned about cost containment and diminishing resources in regards to employees, medical supplies, telemedicine, and preventative health.